Trauma-informed care has become a buzzword. People are talking about it all throughout the country, different organizations, different coalitions. I want to clarify a few things for you as you think about what it means to be trauma-informed in your particular setting. There is no formula for what it looks like to become trauma-informed. So some people ask for like a prescribed list of things that an organization or a system has to do in order to be trauma informed. So there are different principles that we can pull from as we seek to understand what it means to be trauma informed in different settings. But how you apply those principles really depends on the setting that you're working in. It's really going to depend on the system that you're in. It's going to depend on the mission and the vision of the system, also the clients that you're servicing, and the overall purpose of your interactions with those clients. So some people feel like it would be easier or more straightforward if we had lists of things, different prescribed steps to take in becoming trauma informed. Unfortunately, that is not the case. Part of being trauma informed is also being flexible. So we have to work within the systems, work with clients, work with staff members. Also think about the historical context of that organization or that system as we're kind of developing a customized plan for that system to become trauma informed. Trauma-informed care is not about us versus them. It's not about the traumatized versus the untraumatized. It's about us all being in this together. If we're truly honest, most of us have experienced at least one form of trauma, and we're also actively working to support trauma survivors as well. Many of us are in the helping profession because at some point somebody helped us with something really difficult that we went through. It's really important for us to not have this false dichotomy between the traumatized and the untraumatized. Us versus them. It's really all of us in this together, all of us trying to implement strategies in order to grow, in order to develop, in order to become more resilient, in order to become stronger, and to overcome different oppressive forces that have impacted us. Going to one trauma training does not make an organization or an individual trauma informed. There is a lot to be learned about trauma. Trauma impacts our emotions. It impacts the way that our brain works. It impacts our relationships with other people, how we view ourselves, how we view the world around us. Attending one training is really not going to uncover the full depth of how trauma impacts people. It is absolutely a start, but it also, becoming trauma informed is a journey. It's not about like attending trainings and checking off a list of different things that you've accomplished or you've learned about. It's also about figuring out how to apply these principles and also knowing that you're not necessarily going to be able to implement these principles perfectly. Trauma-informed care is just as much about the staff as it is about the clients. There are some agencies that say that they are trauma-informed and they pay no attention to the impact of trauma on staff. Some of us who are engaging in trauma work, who are working with trauma survivors, have ourselves also experienced a lot of trauma. And also, many of us are working in workplace environments that might feel really unsafe. When nobody is acknowledging our safety as helpers, but people are then still expecting us to provide support to trauma survivors, there's a disconnect. How can we provide support to people who've experienced trauma if we are not in a supportive environment? So we can't say, oh, we're implementing trauma-informed policies in our organizational context, but we don't pay attention to the staff. They're just supposed to do their job and not acknowledge the impact of trauma on them. That is absolutely not trauma-informed, and you're actually setting yourself up for failure because you're setting yourself up for burnout, for workers who are overwhelmed, don't know how to express their emotions, and don't feel safe enough to be able to perform their job. Being trauma-informed does not necessarily mean that you have to directly talk to trauma survivors about the trauma that they have been through. So while some people may be ready to talk about their trauma narratives, their trauma stories, not everyone is ready to talk about those things. So part of best practices in trauma-informed treatment is to provide people with opportunities to reflect on their experiences, to organize their memories, to engage in problem-solving strategies, to come to a deeper understanding of themselves, other people, and the world around them. So that can include direct dialogue about trauma, but it doesn't necessarily have to. So don't feel like just because you're not talking about the nitty-gritty of what someone has experienced, that means that you're not engaging in really valuable, important work. Being trauma informed does not mean that we have to be perfect. I don't know who gave us this expectation of perfection. I don't know who told us that in order to be trauma informed, we had to get things right 100% of the time. There's a theorist whose name is Winnicott, and Winnicott talks about the concept of the good enough mother. We can update Winnicott and talk about the concept of the good enough caregiver, but the idea behind this is that a caregiver does not need to be absolutely perfect in order for a child to thrive, to learn, to grow, but the caregiver has to be good enough. So that means that they're good enough to try and develop safety for that child. They're good enough to let that child make mistakes and also to praise them when they are successful. I think it's really important for us to remember the concept of the good enough helper as we're providing support to trauma survivors. So this does not mean that we need to get things perfectly every time. It means that we are doing our best to provide a safe enough environment with enough choices, with enough opportunities for control. And when we don't, it means that we are apologizing. We're acknowledging our failures, our mistakes. We're collaboratively working with a plan to make things better as we go forward in the future.